Some of the biggest questions that I've seen in my research on POTS, which is postural orthostatic tachycardia syndrome, is how do I know the difference between having a POTS episode or an anxiety attack or an issue with low blood sugar, which can be hypoglycemia or diabetes? And further, what am I supposed to do about it? I wanted to take a moment to note that this video is not intended to be medical advice. If you have any concerns or questions, please seek help from a medical professional. It's also important to note that not all symptoms will be present every time, and yes, you can have all three conditions. So why is it so important that you know the difference between the three conditions? If you understand your condition better, you'll be able to explain it to others better. This is especially important when you need to give your doctor a symptoms list, or you want to explain to your family how they can support you during an episode or in your daily life. It's also important to be more knowledgeable about your condition so that you can avoid the dangers of mistreating that condition. For example, if you were to treat anxiety with a higher sodium diet or with carbohydrates that you don't need at that time, you can run the risk of raising your blood pressure to degrees that are too high or gaining weight. So let's talk about a few of the symptoms you might experience during an episode and see which conditions those symptoms fall under. Rapid heart rate, headache, nausea, chest pain, dizziness or lightheadedness, tremors or feeling shaky, excessive sweating, insomnia or trouble sleeping, fatigue, brain fog or trouble focusing, feeling anxious. Other symptoms may include frequent urination, digestive issues, having a shortness of breath, feeling restless, unexplained pain, feeling hungry, weakness, slurred speech, and take note that this symptom may be indicative of an even more serious condition, so take this one very seriously. And mood changes. As you can see, there are so many similarities between these conditions that it can be difficult to diagnose without more comprehensive screening tools. If you are concerned that you may have anxiety, ask yourself if you have had excessive worry about anything in your life recently. If these feelings have persisted for a while, you can use an online screening test like the GAD-7. A link to a GAD test is in the description box below. Please talk to a mental health professional or your primary care physician about your concerns. If you are concerned that you may have hypoglycemia, ask yourself when is the last time you ate something with a little bit of protein in it. A blood glucose test will give you a more definitive answer on how low your blood sugar is. Please see your primary care physician about any concerns you may have about your blood sugar levels. POTS is a serious, long-term condition that affects the cardiovascular system. A tilt table test can give a patient a formal diagnosis. Taking regular blood pressure readings can also give an individual a better picture of their condition. It's important to share your concerns with your primary care physician. They may then refer you to a cardiologist for further testing. To treat anxiety, it may be helpful to engage in cognitive behavioral therapy, which you can learn about when visiting a healthcare professional. Better self-care and other therapeutic methods can also be beneficial. During a hypoglycemic episode, it's important to eat something with carbs to quickly get your blood sugar levels up. Long-term, however, a diet that is balanced with protein, fiber, and complex carbohydrates can help to improve this condition overall. POTS is treated with a combination of medications, physical therapy, a high-sodium diet, compression, and other remedies. If you find yourself in the middle of an episode, here are a few things you can do. First, take a look around you and find 5 things that you can see. Then find 4 things that you can feel. Listen closely. What are 3 things that you can hear? What are 2 things that you can smell? I find that I can only smell one thing at a time, so I need to seek out something like a scented candle that I can smell in that moment. And finally, what is one thing you can taste? This exercise is called the 5-4-3-2-1 grounding technique, and a link to this exercise can be found in the description box below. When you are feeling more grounded, ask yourself, what do I need right now? Do I need to sit? Do I need to eat something? Do I need a quiet space, or is there something else that I haven't thought of? Ask for help when you need it. There are people all around you who may want to help but just don't know how to. If you want to learn more about anything I've talked about in this video, please see the references down in the description box. There are also clickable links with helpful tips for you.